guys, welcome to dental classes for you. Today we shall discuss on a pharmacology topic, that is NSAIDs, that is non-steroidal anti-inflammatory drugs. In the previous class I have discussed about opioid analgesics. In that class it has been discussed about what analgesia means and what are the two types of analgesia, that is narcotic and non-narcotic, and what are the differences between them. So here, NSAIDs or non-steroidal anti-inflammatory drugs are the non-narcotic or non-opioid analgesics. Okay. Now, before moving on to the classification, we will discuss in brief what exactly its mechanism of action is. NSAID's main mechanism of action is inhibiting cyclooxygenase enzyme or Cox enzyme. Okay. This cyclooxygenase enzyme is involved in the reaction, that is conversion of arachidonic acid to prostaglandin. This prostaglandin is actually acting as an hyperalgesic, and by this inhibition what NSAIDs actually does is it will block the pain sensitizing mechanism. Okay. Now cyclooxygenase enzyme actually has two isoforms. They are cyclooxygenase 1 and cyclooxygenase 2. This COX-1 enzyme is actually having physiological housekeeping functions, whereas the cyclooxygenase 2 enzyme or COX-2 enzyme is actually present at the site of inflammation induced by cytokines or other signal molecules. Okay. Also, we have to know that most of the NSAIDs are actually non-selective Cox inhibitors. Okay, they inhibit both COX-1 and COX-2 enzymes. But there are also selective COX-2 inhibitors. Now, we will discuss about the classification. Here, NSAIDs are mainly classified into four types, that is non-selective Cox inhibitors, preferential Cox2 inhibitors, selective Cox2 inhibitors, and analgesic antipyretics with poor anti-inflammatory action. Okay, so they are classified into four types, that is non-selective Cox inhibitors, preferential Cox2 inhibitors, selective Cox2 inhibitors, and analgesic antipyretics with poor anti-inflammatory function. Okay, now we will see sub-classifications of each. Okay, so first of all, non-selective Cox inhibitors. I have made a code here, that is safe PP. So the sub-classifications are salicylates, acetic acid derivatives, phenamate, enolic acid derivatives, propionic acid derivatives, and pyrazolone derivatives. Also, you can remember three acids like acetic acid, enolic acid, propionic acid derivatives. Rest are salicylates, phenamate, and pyrazolone derivatives. Okay. So, safe PP, salicylate, acetic acid, phenamate, enolic acid, propionic acid, and pyrazolone. Now, moving on to examples from each. Salicylate, the example is aspirin. Okay. In acetic acid derivative, there are three examples given, that is indomethacin, nabumetol, and ketorolac. Indomethacin, nabumetol, and ketorolac. You can remember it by the password INC. Okay. Here, all the different drugs sound different because I have given the same code for propionic acid derivatives. There they all end with N. Here they are all very different sounding. Okay. Phenamate, the example is mefenamic acid. Both has fen there. Okay. Mefenamic acid. Then the enolic acid derivatives, that is piroxicam and phenoxycam, you can remember it by PT. Okay. Or you can remember like E and PT like PET. Anyway. Now, propionic acid derivatives, they are ibuprofen, naproxen, and ketoprofen. Ibuprofen, naproxen, and ketoprofen. They can also be given a code INC. Okay. Here they all end with N, similar endings. That's the difference. Okay. Propionic acid derivatives, they all end with N and the code is INC. Ibuprofen, naproxen, and ketoprofen. Okay. Now pyrazolone derivatives. Examples are phenylbutazone, oxyphenbutazone, and propylphenazone. Okay. You can remember it by POP, or at least if you can remember these two, both are butazones, phenylbutazone and oxyphenbutazone. Okay. Now, the next classification is preferential Cox2 inhibitors. Preferential Cox2 inhibitors include nemesalide, aceclofenac, meloxicam, etodolac, and diclofenac. You can give a code named here. Okay. nimesulide, aceclofenac, meloxicam, etodolac and diclofenac. At least remember preferential Cox2 inhibitors, aceclofenac and diclofenac. Selective Cox2 inhibitors. They include paracoxib, etoricoxib and celecoxib. Paracoxib, etoricoxib and celecoxib. Okay. They can be remembered by PEC, or at least you remember all coxib. Okay. Selective are all ending with coxibs. Then the last one is analgesic antipyretic with poor anti-inflammatory action. Analgesics and antipyretic with poor anti-inflammatory action are further classified into para-aminophenol derivative and benzoxazosine derivatives. That is para-aminophenol derivative and benzoxazosine derivatives. Now, para-aminophenol derivative is the paracetamol, okay? And benzoxazosine derivative is nefopam. So that's the classification. I know it's difficult to remember these drugs, but it's better to revise them again and again so that it becomes thorough. Okay. Now you can also read about the uses of NSAIDs, that is antipyretic, anti-inflammatory, analgesic, antiplatelet aggregatory and such. Okay. So finally you can read more about the uses, its mechanism of action, read in detail about aspirin, etc. Hope you have understood this class. For more such videos, like, share and subscribe to my channel. Thank you.